Arkana Laboratories has a fellowship program that's designed within 1 year to train a well-rounded academic renal pathologist. First and foremost, it emphasizes diagnostic excellence. And we do this by starting the fellow off with the very basics, and within a few months allowing them to review and generate a report for up to 5 renal biopsies every day. So through this practice, you're going to be able to see the routine cases of renal pathology and learn how to build a diagnostic report. In addition to that, the renal pathologists here who are assigning out their own cases are going to drop off the most interesting cases of the day, the most challenging cases of the day. So out of these 100 cases that come through the practice every day, you're going to see the most difficult. So you get a concentration of very interesting cases to be able to study and think about. Every single day, we're going to get together and we're going to have a case conference, and the fellow is an integral part of that case conference where we discuss interesting cases, and you're going to hear how other pathologists would approach those cases. There are daily lectures for the first few months that you're going to sit down with a renal pathologist and you're going to discuss particular entities, you're going to discuss cases, you're going to ask questions. So you're going to get individual as well as group training. You can't go through this program without gaining diagnostic expertise, and that is the goal. Additionally, we want the fellow to know what it means to conduct a research project. So we're going to work with the fellow when they first arrive to choose a project that they're interested in. And we want within that year, if we can, we want to take that project all the way from generating data, presenting at a meeting, to ultimately submitting it for peer-reviewed publication, all within the year. Last, we believe that renal pathologists need excellent presentation skills. Renal pathologists in particular are frequently called upon to present at clinical meetings, to present at conferences, and so we want to make sure that we hone those skills while you're in training. This is the opportunity. We believe that it is a lot to go through in 1 year. It would be very difficult to do if you were not 110% focused on learning. And for that reason, we have eliminated to the best of our ability all of the extraneous work, all of the so-called scut work, so that you can focus in on learning for the entire year. And the goal is that when you leave this training program, you'll be able to step straight into clinical practice and you'll feel confident and ready to take on the challenges of being a renal pathology attending.